Thank you guys for being here tonight. As Lisa said, my name's Priscilla Andrews. I'm the clinical director at the Cancer Wellness Center. I have for a long time had a special interest in the transition from being in treatment to being post-treatment. And I think I've been doing this program for at least a decade now, probably longer than that. So it is my little baby, if you will. What was I going to say? I'm going to launch a poll here just to see who we have in the room tonight as far as time relative to the end of treatment. I will say I find some people come, they're already done with treatment, and also have people who are anticipating treatment ending. So I see we've got a little bit of a mix already. We've got some people who finished treatment a little over a year ago, some people that just recently finished treatment. So if you fall into one of those two categories, you are already represented here. And I will revisit the poll in a moment just to be able to post it to share. So what are we here to talk about? Let me share my screen. All right, treatment's done, now what? I mean, if you finish treatment, if you're anticipating treatment, you probably don't need me to tell you that finishing treatment can be a much anticipated event and then can sometimes feel like falling off the side of a cliff because you go from this really intense period of time where you're being monitored, where your treatment may be dictating your routine and your lifestyle. And then depending on your healthcare team, there can be a little bit of a like, go with God, we'll see you in 6 months. So if you experienced that and found yourself like a deer caught in headlights, the good news is that you are in good company. And I'm sure people have come today and they have their own objectives for being here. And I'm hopeful that when I'm done with the presentation, you'll feel like what I went over, if not completely address what you came in here hoping to get out of tonight's program, that it at least is leaving you a bit satiated from what you were hoping to get. I miss the good old days when we were in person because I would actually go around the room and have a whiteboard and write down what everybody was hoping to get out. But so I have 3 main objectives and then a little addendum there. One is I'm going to talk right up front about our nervous system. If you are in the room tonight and you've ever heard me present or have ever talked to me before, you probably know at some point I always bring up the nervous system because it is so key to dictating how we respond to the world around us and especially how we respond in a crisis. And I think really helps contextualize and help us understand, oh, that's why I was responding the way I was. I'm not crazy. There's not anything wrong with me. Some of this may be more predictable than I had initially thought. And so alongside of that, talking about some common responses to completing treatment. Just a sneak preview, there's a lot of responses that are normal, common, understandable responses. There's not just one way to experience that transition to post-treatment. And then also I'm going to talk about some tips and strategies for transitioning into survivorship. To the extent that people feel comfortable or inclined to type a question along the way, please do so because I certainly love to make sure that I'm addressing questions, or if there's something I need to back up or slow down on, I'm happy to do that as well. So I just want to talk about some definitions here. Like first off, I want to talk about the term survivor. In my experience, survivor is a very mixed bag as far as how people feel about that term. When I first started here a couple decades ago, we would label everybody a survivor. And then what would happen is people would say, well, do I qualify because I'm still in treatment? And we would say, yes, you qualify because you're a survivor from the day that you're diagnosed. Then we have survivor, meaning like post-treatment, kind of colloquially, we can say, oh, I'm a cancer survivor. We think about that being post-treatment. Sometimes in research, the term survivor is used, and it's specific to like how far out from the end of treatment somebody is. I think it's a complicated term because the feedback that I get most frequently is, it still feels like it's in process. I'm not quite sure what I survived. It doesn't communicate the extent to which I'm still experiencing the after effects of my diagnosis and treatment, whether that be physical, mental, emotional, spiritual, etc. So if you find yourself feeling ambivalent about the term, or maybe like you're okay with people calling you a survivor, but you don't identify with that yourself. I've had people who outright reject the term. I've people who see it as very positive. I went through something really difficult. That whole spectrum, if you relate to any part of that, just know that you are in good company. I know some people, they prefer the term thriver. That tends to be the like, well, I don't like survivor. I like to tell people I'm a thriver. So take that for what it's worth. I do like the term survivorship. I've stopped personally using the term survivor. I typically say like person who is diagnosed with treatment with cancer, or somebody who's finished treatment for cancer. Myself, just because I know it can be a complicated term. I do like survivorship because I know that seems a little bit at odds with, well, you don't like survivor. But the thing I like survivor is actually the definition, because I don't probably need to tell you that what makes cancer so complex is, yes, it is a biological process. It is something that is medically treated. However, it has an impact on not only the person with the diagnosis, but also the people close to them in their lives. Shout out to the family member and family members in the room tonight that go beyond the medical and the physical aspects of the diagnosis, right? And survivorship is really a term that is meant to encompass the fact that there is a whole person that is impacted by the cancer diagnosis, and to take into account the fact that, I always say like cancer is sort of like this spider web that gets shot out and can impact us emotionally, mentally, psychologically, financially, spiritually, in addition to the physical impact of the diagnosis. So I want to talk about some expectations that people commonly have as they head into treatment. I call it shooting all over yourself. And sometimes the expectations that we have, we don't even realize we have them until the expectations haven't been met. I have a lot of people when I'll ask what did they expect beforehand, and they'll be like, I don't know what I expected, but I can tell you I didn't think it was going to be like this, right? So some of the expectations are silent, and they're silent to yourself. Sometimes the expectations are ones that people thrust upon us, right? So there's these expectations around, I'm going to be wanting to celebrate that sort of like proverbial, like, I'm going to go to Disneyland, right? On a smaller scale, it can look like, well, we're going to go out for dinner, we're going to throw a party, or even things as simple as like ringing the bell at the last chemo treatment. And certainly people can feel relief or just gratitude of like, I don't have to do that anymore. I'm done with that. Typically, though, it's a much more complex experience. And that idea of being ready to celebrate is something that you have to contend with yourself, but then also contend with other people's expectations that you're going to want to be celebrating. There's also this idea I'm going to feel well, right? I'm going to be done with treatment, so I'm going to go back to feeling the way that I did before. A rubric that I typically recommend is if you think about, like, if you've been in chemo for every chemo treatment, anticipate a month of recovery. And that month of recovery is to get you to a place after you count up those treatments and the equivalent months of kind of getting a better sense of, okay, this is maybe more of where I'm going to land after the impact of treatment. And now maybe I can start to get a better handle of what I can expect from myself physically. Now, that doesn't take into account many people have multiple types of treatment. Maybe you've had surgery, maybe you've had surgery and chemo, maybe you've had surgery, chemo, and radiation, or you've had immunotherapy, or you had to have a stem cell transplant, right? So those all complicate the trajectory of how long it is going to take your body to recover from what it's just been through. And then also I'm going to go back to being the person I was before cancer. And this is the one of these myths that there's so many major life events that we can experience where we just anticipate somebody's going to come out the other side of it with a different perspective or different feeling, different set of priorities, even if it's only temporary. But a lot of times cancer can be one where there is an expectation, if not for oneself, for people somewhere in their social sphere, that things are just going to go right back to where they were before they heard the words, you have cancer, before you had to go through the anxiety of treatment planning, before you had to go through the rigor of treatment. And that's often just not a realistic expectation. And it doesn't mean that you're going to be a totally different person or that you even want to be a totally different person. It just means that there is something about going through this experience that is often going to change your attitude towards at least one aspect of your life, if not several. I think another thing that can happen, I find in general, if somebody's going to be good, is going to have people that are good at showing up, it's going to be during treatment. And then after treatment is done, the meal trains fall away, the texts to check in fall away, the offers to help with childcare fall away, right? And what does that all communicate? Well, you don't need me anymore. You're back to being self-sufficient. You don't need the support. And I often find that transition into post-treatment can be one of the most distressing transition points, in part because people are so confused by how they're feeling and confused about where they're at mentally, confused about where they're at emotionally, caught off guard with how they're still maybe physically coping with the side effects of treatment, and really may need support, not just from a task perspective, but also emotionally. And I think there's also this idea of I'm just going to be grateful. And sure, gratitude is a part of it. It just isn't the only piece of it. And that gratitude, I think, is very sneaky because it is something that we can expect of ourselves. And certainly a gratitude practice to cultivate gratitude can be really meaningful. But a gratitude practice doesn't mean that that's the only feeling you're allowed to have. Um, and I think the gratitude piece gets very implicitly suggested from others, but also from the healthcare team, where quality of life issues that are not viewed as big enough can get minimized or just not discussed. I think one example is thinking about issues around sexual health and doctors not doing a real adequate job, generally speaking. And this isn't a criticism to any one doctor or healthcare system. This is like what research shows is like that's just not brought up, or that doctors are ill-equipped to address that, right? And so the idea being, well, it doesn't matter if that part of your life isn't functioning the way that it did before. You should just be happy that you're still here. And that's not the whole story. And I think when we get to, um, the end of treatment, I always think of it as sort of being like this baby bird where your healthcare team kind of pushes you out of the nest and says, okay, go fly. And that is after a very rigorous period of time where there's a lot of contact, where you're very much involved with doing something about the cancer. It could be anywhere from every several weeks to every day, depending on what treatment you're at. And then at the end of treatment, it's like, okay, I'll see you in 3 months. See you in 6 months. And it's like the floor drops out. And there's this woman, Jimmy Holland. She was a psychologist, and she was kind of like the grandmother, if you will, of like psychosocial oncology. Psychosocial oncology just means like looking at how a cancer diagnosis impacts the whole person. And she had this phrase, she would say that people, when they're done with a treatment, may be disease free, but they're not free of the disease, right? You're still wrestling with what impact it has, what meaning it has. Sometimes being in post treatment is like the first time that people really have to take a moment to sort of look around and say, like, what just happened here? It might be the first time that you have to like really try to understand and be in a frame of mind to like go back and be like, why did I have that treatment? What did my pathology report? Right, there can be a lot of unpacking that goes on when people are in post treatment that sometimes you're just not prepared for, because treatment can be so arduous that you really do want to just put the experience in the rear view mirror. And that can be very disconcerting to find that it's not as easy to just put it back here and not find yourself glancing back at it on a regular basis. Um, so I'm thinking about our nervous system. I like to talk about how we are like pre-wired as humans to respond to a crisis, because I think it gives a really good frame to understand why you may have responded the way you did and why you may have had certain signs of stress show up for you. Um, and there's this guy, his name was Hans Selye. He was an endocrinologist, and he was interested in understanding how we respond to stress and how we respond in a crisis. And his research is from like mid 20th century. So it's really been built upon since then, but I think it really still gives this really helpful foundational understanding of a stress response in humans. And he called it the general adaptation syndrome. That was just the name of his theory. And what he looked at, he had some key findings. One was that we all have a general resistance level to stress, right? And if you think about that as like anything below that resistance level, we're kind of going to be able to like weather the storm, right? And so we can think about people that have like a really high resistance to stress. Like nothing seems to bother them. They just seem to be able to go with the flow and absorb a lot of stressors without ever really showing signs of stress. And then there's people, I call them, they've got like cancer of the hangnail, right? Like every little thing kind of bothers them. They maybe often seem frazzled, or maybe they seem very detached from what's going on around them, right? But for the purposes of today, we're going to just all assume we're just kind of middle of the road people who have this general resistance to stress. So that was one thing that Selye discovered. The other thing that he discovered was that in the immediacy of a stressor, of a crisis, that stressor can actually cause our resistance to stress to be compromised. He called that the alarm phase. So if our resistance to stress is pressed upon and is not high enough to compensate from the level of stress that we are under. What happens is we show our signs of stress. And you can see there's these like 4 broad categories. And I always think of it as like inside we each have our own tuner. If you guys remember when you'd have like a stereo and it would be in a cabinet and there'd be like 17 different things stacked to help you to listen to the radio, and you'd move these dials to get the sound to sound differently. And sometimes you'd have something high and sometimes you've had something low. That's how I think about our signs of stress, right? We each have this profile. And so you may look at this list and it's not an exhaustive list. And you might say, yeah, like that, maybe I often feel anxious. Sometimes I get irritable. That's a little less pronounced for me, right? It's typical. We have signs of stress in all 4 of these categories. Some of them may be pronounced than others. I find some people are very attuned to what their signs of stress are when their level of stress gets so high that they can no longer tolerate it at all. And they really, one of the things that I often find that I talk to them about is like, can we notice the more subtle signs that you're under stress that are not flashing in your face like an alarm bell? So just know that if you have noticed that you showed some of these signs of stress, especially in the immediacy of finding out about the cancer diagnosis, that would be typical. That would be understandable, right? Cancer is a crisis. It's a manageable crisis. It's a crisis nonetheless. And it is a crisis that is situated, I should add, relative to the other crises that you've had in your life. So for some of you here tonight, maybe cancer is the biggest crisis that you've experienced in your life. And maybe you've had lots of other crises. And the cancer is a crisis, but it sort of fits within other crises, right? Like I had a client who had a blood clotting disorder, and it meant that she could have a stroke at any time. And then she got cancer. And part of our discussion was the cancer was a big deal. And everybody was sort of telling her, wow, this is a big deal. And she was like, it just doesn't feel, yes, it's a big deal, but I'm really stressed out about this blood clotting disorder that I have, right? And so, how do I make sense of the fact that, like, that feels like much more of a crisis? And it helped her to place that to understand how she responded to the diagnosis versus this other condition that she had. So, thinking about other crises, and maybe they're not even medical crises. You can have other crises going on in your life. And this curve of how we respond to a crisis is not specific to a cancer diagnosis. So as I'm talking about this, you may relate to it through a lens of other things that you have went through or other things that you're going through in addition to the cancer diagnosis. So now what happens after the alarm phase? After the alarm phase, we go into this phase of resistance, where our resistance to stress doesn't just return to our normal level, it gets elevated. It gets elevated by stress hormones, adrenaline, cortisol, that help us meet the demands of our environment. Now, the challenge is that our system is only wired for this to be a like short-term response, right? Like the example, like if we think like in caveman days, right, this response was to allow us that there's a saber-toothed tiger and we have to learn to like, we have to figure out, are we going to fight it or are we going to run away, right? And we're going to have that for a time limited period of time. We're going to get back to safety, and then our system is going to return to baseline, right? Maybe a more modern example would be, you get into a fender bender, maybe in the immediacy, your heart's racing, you're nervous about what happened, you're kind of a little like shell shocked in that moment. You get out of the car. Are you okay? Are you okay? Is the car okay? You start to exchange information. The police show up, and that reaction tempers down and you go back to baseline. The challenge is that with a cancer diagnosis, it's not just one thing, right? It's not like, oh yeah, you have cancer and bada boom, bada bing, it's all over by the next day. No, you get the diagnosis, you got to go through maybe more imaging studies and uh, not imaging studies, lab tests, biopsy to figure out what's going on. You got to go through treatment planning. Maybe you have chemo, maybe you have surgery, you have radiation, right? It goes on and on and on, right? It can be months, it can be years for some of the people in the room here with me tonight, right? And what happens is at a certain point, everybody's resources get exhausted. That's not you, that's not me, that's just how we're wired, right? We just reach a limit. And when we reach that limit in what Selye would call the exhaustion phase, then what happens is our resistance to stress doesn't just return to our baseline, it actually goes lower than what it was before all this mess happened to us. So one of the most common things that I hear from people when they're post-treatment is they say, I don't understand. I'm more short-term tempered with my kids. I cry at a drop of a hat. Things that used to stress me out. I can't seem to get excited about things that used to excite me. Everything kind of feels a little flat right now. I feel really anxious about things when I'm not normally an anxious person, right? The lens I think about that through is like, yeah, because your nervous system is like just like reverberating from this stressor. Now, the good thing I will say is that there are things that we can do, and there's things that I'm going to talk about today that can help us return to our baseline, can help us bolster our baseline so that our baseline resistance to stress is actually just in a general way, not because of stress hormones elevated. And we can do things that, like, when that elevation of stress response happens, we can return to our baseline more efficiently, because we don't really want to stay in that elevated state of resistance to stress for this extended period of time. Now, I should say this isn't like a one-to-one. It's not like everybody goes through alarm and then their resistance and then they hit post-treatment and then they go into exhaustion. I mean, people can cycle in and out of this throughout the cancer experience. I just kind of want to highlight, though, that like if you find that it's like I was the one thing I hear a lot is, I freaked out when I heard about the diagnosis. I was scared, I was crying, I was anxious. And then I don't know what happened. Like, I found out my treatment plan and I kind of just like, I got through it and I couldn't believe how well I did. And then I finished treatment and now what's my problem? I feel like I'm going crazy. I feel like there's something wrong with me. But there's a whole host of normal things for us to experience, right? I think it's a really good reminder. What is emotions, right? What is that at root? We call them feelings. Why do we call them feelings? Because they are words that we have that we apply to a physiological response in our body, right? If I say sad, you can think about how that feels different than angry, which feels different than anxious, right? Which feels different than numb, right? All of those are emotion words because something has happened in our body that is basically like sending out an alert that there's something going on here. And we're not in like a homeostasis state. It's trying to give us important information. So you can see there's all these normal feelings that we can have, and it's normal to have those at the same time. If you haven't seen the original Inside Out, I really recommend it because it does a beautiful job of really highlighting the fact that we can have experiences that feel in opposition to one another, but can actually co-occur. I think bittersweet is one phrase that we can kind of understand, because what's bittersweet? There is a sadness to it, but there's also this like pleasure, kind of nostalgia feeling happening at the same time. Right? How can we have pleasure and feel sad at the same time? But we do. So we can feel relief and gratitude. We could feel happy to be done with it while also feeling very anxious, feeling stressed out. I think I like to highlight feeling isolated moving into post-treatment that can be isolated because people maybe in the social network fall away, isolated because I'm not seeing my healthcare team, isolated because I feel like my experience is not as well understood. I also like numb, okay? Numb is actually a feeling. Numb is the circuit breaker popping. Numb is what our nervous system does to take care of us when we just can't anymore. And numb is protective. We need numb. We can't feel everything all the time, or we could be paralyzed by our feelings. Numb is problematic if numb is all you can feel, right? If you can't get out of numb, if you don't, if the things that you enjoy, you're just ambivalent about, right? If everything metaphorically, because I know sometimes taste buds can be impacted. If metaphorically everything tastes bland, right? If everything you do is bland, right? Like that's telling you something important and likely something that is meaningful to reach out for support around. But I highlight that because sometimes numb gets overlooked. Like if I'm not feeling anxious, I'm not angry, I'm not sad, I'm just kind of not feeling anything. But the absence of feeling anything is something of note as well. Years ago, I had somebody mention this. They said, "Oh man, I saw this cartoon and I felt like it really spoke to me because I feel like the people around me are feeling like I'm different." And I'm like, what did they expect? Right? Sometimes the change is temporary, um, right? Sometimes even the physical change is temporary. Sometimes the change is more long lasting, right? We could think about physical changes that are long lasting. If you're somebody who had to have a part of maybe you had a mastectomy, maybe you had a colostomy, right? Something that is like not coming back and your body is literally permanently changed. Sometimes I think the post-treatment phase, one of the things that can be disorienting about it is like there is this process where you're in process. Like you may not know exactly where you're going to land. You might not know what was a part of your life from before cancer you want to bring back, and maybe what parts of it you're relieved about not having to engage with, or maybe they just don't feel as important to you anymore, right? Like, and where that all falls out is not a like black and white process, and it's not a process that happens instantaneously. It happens over time, and at the end of it, it either the post-treatment phase either is this time period of being changed, or more like a hallway that you're walking through to figure out, okay, at the end of this hallway, where am I going to land? Because it's not going to be where I started. I'm going to pause here before I move to tips to just see if there's any questions about, because that's probably the most technical, let's say technical part of what I'm going to talk about. If people had any questions, or if there was something that I said that really resonated that you want to highlight in the chat, both for yourself, but for the other people here with us tonight. And it doesn't matter how many years I've been doing this online, I still have not figured out the right amount of time to give people. um, so what I'll do is I'm going to put it out there. I have the chat open. So if you're trying to formulate a question or a thought, I'm going to move ahead and then I will come back if somebody feels like there's something they want to have some more time to pause on or have a question addressed around. So let's talk about some tips. Okay, tip number one, be patient with yourself and others. Now, I want to acknowledge it is super easy to tell somebody to be patient. I feel like being patient is like right up there with somebody saying calm down and relax. Like they actually often have the opposite effect when somebody says it to you. And I will tell you, if just like if I had some like magic elixir for patients, I would I would be on the newborn baby parent circuit, and I would be selling it to them, people who have toddlers and people who have teenagers, because I'd be super duper wealthy if I could come up with something that just like gave people patience. I want to acknowledge that's a little more complicated than that, and I want to just make sure. Okay. Um, and I want to acknowledge somebody just noted the notion of really connecting with that gratitude isn't the only emotion you're allowed to have. Yeah, right. And just because you feel something else doesn't mean you're not grateful, right? You get to be grateful and angry. You get to be grateful and scared. You get to be grateful and sad, right? Those are not mutually exclusive experiences. And gratitude is not an elixir for those other emotions. I mean, gratitude is a valuable practice that can bolster overall well being, but overall well being doesn't mean that you're just joyful, calm all the time and like Zen. That's just not a realistic, that's not how we come built. I mean, in any given day, our nervous system is always having fluctuations. Maybe less jarring fluctuations than after or during or after a cancer treatment experience. Maybe easier to like come back from, or regulate from. But it's typical in any given day to notice you kind of go up and down as far as your mood goes. Um, but okay, so there are things that we can do um, to help try to cultivate patience, right? One thing is recognize you're going to have good and bad days. And sometimes it's going to be in the same day. That's one of the things that can be super confusing, right? I had a good day and now I had a bad day. I had lots of energy yesterday and now I'm exhausted and I can't do anything. Or I started out really strong in the morning and then in the evening I totally like bottomed out as far as energy goes, right? Or I mean, I think fatigue is often the biggest thing that people really struggle with is like where their energy level is at. And I will say that, um, notice if there's a pattern, right? Notice if like I have a lot of energy first thing in the morning and then by 3 o'clock I'm pooped, right? Because then that can help you make choices to say, I know by 3 o'clock I'm kind of out of energy, but I really want to go to that dinner with my friends or my family members in from out of town, and I really want to make the most of their visit. And so you can be more planful. This morning I'm going to take it easy to see if I can reserve some of that energy, or I'm going to try to be more compassionate with myself. And I'm going to communicate like, hey, can we do something more low key? Because I know I'm just not going to have the energy to drive into the city for that restaurant. Um, and then, I think the other thing is like, going at your own pace and taking things on based on what you feel like you have energy for. Because people can give a lot of advice, and some of the advice is well meaning, and some of the advice is good advice. But that doesn't mean that just because somebody suggested you do something that it's, excuse me, going to be something that you can like enact right away. And so you need to give yourself permission to heal and to set realistic goals, right? I always say what we do is we tend to say, okay, here's where I was before, and that's where I want to get back to. And so now all of a sudden I'm climbing Mount Kilimanjaro. I got to get to the top to achieve where I was. And like I said, sometimes getting to the top may or may not be realistic based on the specifics of your diagnosis, the specifics of your treatment, right? So what happens if I'm looking at my goal? I'm constantly using my goal as a comparison point. I'm always falling short. I'm like looking up. I'm going to get a crick in my neck from that. So what I always suggest is like, take your worst day. That day you couldn't get out of bed, you took a shower and had to take a nap, that becomes your point of comparison, because that point of comparison is going to be a much better way to measure your recovery than comparing what you haven't been able to achieve yet. Right? Like I had somebody I saw, they were like a big walker, and they were really lamenting the fact that they couldn't walk. They couldn't go for like the like outdoor walks that they used to go for. I think they lived in like a big complex that had like trails around it, right? You couldn't do that. And they were like, I all the most I can do is walk out and get my mail, and then I need to take, then I'm like, I gotta rest. And I was like, well, what was your like worst day? And they were like, woof. Well, there was a period of time where like if I got up and like got dressed, I had to like sit down and rest. If I got up and took a shower, like that was a big deal. And so I was like, okay, cool. Can we use that as your comparison point? And once we did that, then that person was able to see like, wow, like there was a period of time when there was no way I was going to get my nail. Like there was no way that I was like taking a shower and actually making myself breakfast afterwards, right? And so they were able to see that they were making progress. It might not have been at the pace that they hoped for, but that things were not as static as they thought that they were. Um, I think grief too, we think of grief as associated typically with losing a person, but grief is a normal human response to loss. And there can be lots of losses when it comes to cancer, right? Like I've talked about, like there can be loss in body parts, there can be loss in functioning, there can be loss in sense of self, there can be a loss as far as, can I view myself as a healthy person? A loss in a feeling of being able to be carefree, a loss of time, right? Losses can pile up there. And if we don't allow ourselves an opportunity and space to grieve, then we are going to be wrestling with that grief a lot longer. And it's often going to be a silent fight that we're in. And typically, when we allow ourselves to acknowledge that sense of loss and grief, it creates space for us to reassess and be able to see what is still present and what is still possible, and not feel so blinded by the things that are no longer there. But we have to allow ourselves to say, this hurts that I lost that year of time, that summer was not spent doing what I wanted to do, that my body isn't the same that it was before. That really is a kind of a necessary component to get to the point of saying my body's not the same as it was before, and I can still do so many of the things I enjoy, and there are parts of my body that I can still enjoy, and I still have I still was able to enjoy certain parts of my summer, right? Like that can be very complicated if the grief is made invisible. The other thing is like friends and family, some people are going to get it, some people are not. That's why I appreciate the family members that are here, because either it tells me one of two things, and typically two things in concert. One is that you get some sense that there's something here, right? Or if not that, at least you're willing to be here and be present to try to understand this part of your loved one's experience. And I will also say that there's parts of what I'm sharing that you may identify with yourself, because the cancer may not have lived in your body, but the cancer was existing as something that you and your family had to cope with and live with, and continues to have to cope with and live with. Um, I want to just acknowledge somebody else shared, and certainly a very complicated experience, right? Which is what happens if you've had cancer and are still here and have, been through treatment and are stable or no evidence of disease, and you have family members that died of cancer, right? That's, survivor's guilt, like that's the term that kind of in nomenclature we apply. But like, how do we make sense of and make meaning of the fact that like I'm here and they're not. And there can be gratitude and perspective. There can be guilt around that. Um, there can be spiritual crisis around that, right? Like that kind of, why does God have why do bad things happen to good people, right? And that can be a loss as well. It's like if you're very connected to a religion or a spiritual practice or a spiritual belief, and those beliefs have been pushed upon by the cancer experience, especially if you are and your family are a part of a faith community that's really important to you or has been important to you, and you're not connecting to it in the same way, that's another piece that, I certainly, I think when that has come up, I think people have really benefited from having somebody to talk to about that, whether it be like a clinician, like a non-religiously affiliated clinician. Sometimes having a therapist that is religiously affiliated, like a Christian counselor or a therapist that practices, from a Jewish faith perspective. So sometimes talking to a religious leader can also be helpful, but sometimes people are like, I don't need that. I need to talk to somebody who's not religiously affiliated, because that's where it's gotten complicated. So just want to name that as well as one of the things that can be complicated. This is going to be a point where I'm going to open it up if anybody wants to share a thought or a question. I'm going to move to the next slide, but feel free to add something to the chat and I'll come back to it as people share. So find ways to be empowered. What does that mean? Empowered really means there's this idea of locus of control, right? Where do we sense that our control lies? Do we have an external locus of control, which means I have no control over anything, and things are just happening to me and I'm at the mercy of what's going on around me? Or do I have a sense of internal locus of control, right? I'm aware of the things that I have some power over, that I can move the needle on, that I have choice in. Um, and cancer can really push against that internal locus of control. I don't know many people, and I say that sarcastically, who choose to get cancer. That number is basically zero. I don't know anybody that chooses to get cancer, right? That's not in your control. And a lot of times, the idea of having control over your treatment is like a false choice. It's like, well, you can do the treatment or not. Okay, okay. Yes, technically there's a choice, but it doesn't really feel like a choice, right? The healthcare system, right, might say you're going to be here at this day, at this time for treatment. You're going to see your doctor at this day, at this time. And I don't care if it doesn't work for you. And I don't care if you're not a morning person. I don't care if it messes with your work schedule. That's what you got to do, right? All these pressures, all these, like, this is not in my control, right? So it's really powerful to identify what is in my control, okay? One of the things that can be in your control is being informed. And I always say, just because you asked a question once doesn't mean you don't get to ask it again. We know that in a crisis, a different part of our brain gets clicked on, and we do not process information in the same way. So whatever your doctor shared with you when the biopsy results, the pathology report first came in, whatever they shared with you about why they chose the treatment plan they did, if that at this point feels like it's the parents from the Peanuts talking and it was like, wah, 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 right? You go back, you can ask those questions again. Maybe you need different information. Maybe you're in a place of wanting to understand it in a more detailed way, right? That is a really valuable thing to go back and have conversations with your doctor about. Another thing too about talking to your doctor is knowing what's my plan. What is they often talk about it as a survivorship care plan, right? Survivorship care plan basically means what just happened, what do I know, and what do I need to do next, right? And electronic medical records make it fairly easy to complete parts of this, right? We want to know, where can I go to find the information so I know that I can, if I ever need to get to it, I know where my treatment where my chemo regimen was. I know where my pathology report was. Getting an orientation of where that is, it doesn't mean maybe you want to read through a page by page, but to at least know where you can access it can be very meaningful. Some people, it's helpful to go back and have a conversation about, like, help me understand, like, what did this mean on the pathology report? Now, the other thing to talk about as part of the survivorship care plan is, okay, what's my surveillance plan, right? Who am I going to see when? What tests am I going to have? What imaging studies? What am I going to be monitored for? I think it can also be helpful, and this is a person by person basis as far as whether you think that this will be useful, is to talk to the doctor about, like, what are you going to be looking out for? Because it's normal for people, like, every time you have a symptom, now you've got the cancer glasses on, and no matter what the ache or pain is, it's going to be this uh-oh trigger of, like, does that mean the cancer's back? And sometimes talking to the doctor to understand, like, okay, like, this is probably, like, this is what I would be alert for. I'm going to monitor this blood level. And, if you noticed X, Y, and Z, that's what that would cause me to send you for more screenings, right? Sometimes the doctor's going to say, like, we're just going to monitor your lab levels, or we're going to look at your imaging studies, right? Like, you're not going to have a headache that tells me that your cancer is back, right? So sometimes having some of those conversations, even if the anxiety is still there, at least it can give you a little pot of information that you might be able to turn to help diffuse the anxiety when you have other stuff come up in your body. Because I wish that, like, having cancer would just, like, give you a get out of jail free card for any sort of other medical thing or any other physical ailments to come up. But unfortunately, it doesn't work that way. So we just want to be able to have a way to manage the anxiety that can crop up around that. Um, the other thing, like I said, is just clarifying whatever information that you may need. Some people talking about prognosis, you've got to know yourself about whether that's going to be helpful. Um, you know, Depending on how you operate, talking to the doctor about, like, if the cancer came back, what would happen? What would we do? I know that that can sound so threatening. And you're like, Priscilla, why are you causing me anxiety? That's not what I came here for. So just hear me out here. What I have found is, like, fear of recurrence is, like, across the board. Like, if somebody doesn't express or acknowledge, like, yeah, sometimes I get afraid, I'm actually sometimes more worried about that person because it's just so common. I'm not saying that, like, there's something wrong with you if you're feeling really confident about your diagnosis. I'm just trying to communicate, like, if that worries you, of course, right? Um, I think there can be a lot of fear of the unknown, and we can fill in the blanks ourselves. And sometimes having a picture of what it would actually be like what would happen, and having the doctor say, like, oh yeah, I have a plan. This is what we do. And, this is what that would look like, can at least reduce some of that anxiety, because you're not left with, like, this, like, black hole that's just, like, sucking your anxiety energy into it. You have some idea of, like, okay, like, my doctor has a plan of what would happen. God forbid that should come to pass. Um, Now, I think one of the things to think about when you're having these conversations is how to make the most of your doctor's appointment. Like, how can I have really effective communication with my doctor? Um, and thinking about this as an acronym, like, take part, right? PART. I'm going to prepare. I'm going to think about, okay, what do I need to know? What do I need to talk about with my doctor? Maybe always helpful if you've got, like, a care partner, a spouse, a family member that either goes with you to appointments, or maybe even helps you in addition to that, like, talk through, okay, what are we hoping for at this appointment, to identify questions and then ask the questions. I will tell you, personally, when I went to doctor's appointments that were, like, high stakes, I type out the questions and I print out a copy for me and I print out a copy for the doctor and I say, well, here's my agenda for today, right? And it's really helpful because number one, it's right there. You have it in front of you. They have it in front of you. And if they haven't answered the questions, what it does is it says they better find somebody else to answer those questions for you. They better send in the nurse practitioner or they better follow up with you on the portal, right? It's very clear that you have what you need to get out of the appointment. I'm going to skip over R and just say take action, right? That just means you're following the doctor's guidance. You're circling back to prepare for the next appointment. What I find is most people I talk to, they do the preparation, they ask the questions, they follow through with the guidance. What they don't do is they repeat what they've heard. And that is such a valuable piece because it allows the doctor to clarify if there's been a misunderstanding or if they've left something out. Because when we're hearing information that's either difficult to understand and process or is anxiety provoking, you know, I mean, I'm sure if I asked you guys to raise your hands, I am sure there's more than one of you that went into a doctor's appointment and came back and you were talking to the person that was in the appointment, the family member in the appointment with you, and the two of you heard totally different things. Like maybe there was overlap, but like one person heard one thing and you're like, I didn't hear that, or I took that in totally different, right? And then you're like, well, who was right? Right? So if you repeat back to the doctor, you know, doctors are fallible. Sometimes they're not clear. Sometimes they forget to say something. And I mean, like, literally, like, okay, what I heard you say is I'm going to follow up with you and the surgeon every 6 months. And what you'd like me to do is follow up with you in 3 months and follow up with the surgeon in 6 months so that I'm seeing one of you every 3 months for the next year. Is that accurate? What I hear you saying is, if I come and see you, it's best for me to arrange for my blood work a week before so that you have my test results when I see you. Is that accurate? Right? Then there's like, we're all on the same page. It allows them to reinforce it. And also, in the process of doing that, you're having to reprocess it and make sure you're clear about it as well. I didn't have any questions from the piece I just most recently went on. I'm going to move on to a new strategy for empowerment. Again, if something about communication with your healthcare team, with survivorship care plan, if you've got a question or a comment, please put it in the chat. I want to acknowledge some healthcare systems do a real bang up job of that. They have specific programs. Other like specific oncologists do a great job with survivorship care planning. The other piece I didn't mention, just going back to that slide for a second, is long-term side effects, right? What are side effects that might linger? What are things that could crop up as time goes on, right? Those are also a power of survivorship care planning. So some healthcare systems, some oncologist practices are really great at doing this and offering it. If your doctor has not scheduled a survivorship care plan meeting with you, or you have yet to have your first follow-up meeting, ask, hey, is this when we're going to go over my surveillance plan? Is this when I'm going to have a chance to ask you questions about what I just went through so that I make sure I understand everything? Okay. Next idea for empowerment is sort of two parts. One is relaxation practices, the other is physical activity. They kind of go hand in hand. They really are about the physical recovery of the impact of sustained stress on your system. So why relaxation? Okay. Remember I talked about that curve, right? We have the stress response. We've got these stress hormones that come on board, right? In the face of threat, we have two broad responses we can go into. We can go into mobilization, which is like fight or flight. I got to do something. Do something can be very active. I can't sit still. You know, the people who are like, when I get stressed out, I clean my house. I wish I had that. If you have it, please come to my house. Or it can also be physically inactive, but my mind is going. I'm making lists, I'm planning, I'm revisiting things, I'm going over things. One thought leads to the other. The other thing that can happen is we downshift and we go into immobilization. I'm here, but I'm not really here. Remember that numbness that I talked about, right? That's also a state, a survival state that our system goes into. Whether we're in a mobilized state or a collapsed state, our nervous system is in a survival state, which is basically like saying, uh-oh, things are not okay. And not only are things not okay, imminently they're not okay, right? Being in a survival state is intended for like we are about to get hit by a bus and we got to figure out what to do, right? So the way that our nervous system responds to like the ongoing stress of a cancer diagnosis, even if we're not imminently in dire, like the next minute is going to decide whether I live or die. Our nervous system, the part of our nervous system that responds with those survival states, is the same part of our nervous system that would be responding if we were being chased by a bear, right? And the challenge is when we get into that state, our body starts this feedback loop that can perpetuate keeping us in that state. Our nerves, 20% of our nerves go from our brain to our body. 80% of our nerves go from our body to our brain. So once we're in this physiological mobilization or collapse, our nervous system is sending signals to our brain, and our brain is like, oh man, Priscilla must be being chased by a bear, better keep it going. And relaxation techniques utilize it, they kind of capitalize on that. And when we cause a relaxation response in our body, it sends a signal to our brain that says, call down the guards, right? Call off the troops. We don't need to stay in a state of mobilization or collapse. And that is really valuable because it is when we are in homeostasis, meaning we're not in a survival state. The homeostasis in our nervous system is the optimal state for recovery and healing. It is when all of our systems are working at their best, and our respiration, our heart rate, our immune system, right? All of those processes that are just always going on and we're not consciously aware of, when we are in homeostasis, they can all be optimized, which helps us heal. So, that's like, I will tell people, like, that's why deep breathing, right? Why is it that we're always talking about take a deep breath, right? And it kind of has become a little bit trite, and we don't always, like, I think we talk about it a lot in our culture, we can, without really talking about why. But that's why. When we take deep breaths, we slow down our respiration rate, we elicit a relaxation response in our body. The response in our body sends signals up to our brain. It says stand down, and it allows us to get to an optimal place of recovery and healing. Now, there's lots of different things that we can do for a relaxation response. Some of those things are like I call them kind of explicit. Like we really are doing something to elicit a relaxation response in our body. Deep breathing, yoga, guided imagery, Tai Chi, meditation, right? These are things where like we're doing it in order to relax. Now, there's other things I think of them as like implicit relaxation, meaning maybe there are things that we do and we don't overtly think of them, is causing a relaxation response, but they have that that impact, right? So like creative outlets can be like that. Socializing with people can be like that. You can see some of the social connection things. I've left artifacts from COVID there, mainly to say like maybe some of the people that you really connect with are not physically here. Um, but it would still be meaningful to have that phone call, to schedule that Zoom, right? We still have virtual groups just to make them more accessible to people. That's still very meaningful. But finding things that you find are nourishing and replenishing, and even taking, thinking about what were the things that I used to do that got put on hold because so much was being demanded of me of cancer treatment, that it would be helpful for me to bring back in. Um, Now, physical activity kind of it kind of goes hand in hand. There's lots of research that shows the benefits of physical activity, and I'm not talking about like um, we're going to get a giant tiger and we're going to flip it around and I can't think of CrossFit. We're not doing CrossFit. We're not doing like hot yoga, right? I'm not talking about like training for a marathon, right? When I talk about physical activity, I'm talking about 30 minutes of activity that raises your heart rate 5 days a week. Walking, right? That is physical activity, right? And I want to acknowledge if you were somebody who was very physically active, and like maybe you were somebody who did CrossFit, God bless you. Um, sometimes it can be hard to like downshift your expectation of yourself if you're used to performing at a very high level, and maybe the cancer diagnosis and treatment have caused you to have to reassess what physical activity, how you define physical activity. But we're really talking about 30 minutes of activity, raised heart rate 5 days a week. Not cancer, such a complex thing. If we could point to one thing that caused different types of cancer, then everybody who did that thing or had that thing would have cancer. But that's not true, right? If smoking caused everybody to have cancer, then everybody who smoked would have cancer. If that was the thing, right? If eating bacon caused cancer alone, bacon alone caused cancer, anybody who ate bacon would have cancer, but it's not, right? Cancer is super complex. And I say that because while what causes cancer is incredibly complex, what we do know is there's some things that can contribute to a lower risk of recurrence. One of those things is practicing stress management techniques, like I just talked about. The other thing we know is physical activity. Physical activity has a benefit of lowering of risk of recurrence. It also, in the moment, has a really valuable impact on quality of life, right? It can reduce fatigue. I know that can feel counterintuitive. It can reduce fatigue. It can help manage stress, reduce distress around symptoms like depression and anxiety, right? So it really has the capacity of helping both the physical self, but also the emotional and psychological self as well. Now, sometimes people like, I would always ask people about like, what stress management did you do? Like, did you do anything for stress management before your cancer? And I would say vast majority, uh, at least 60%, maybe 75%, don't hold me to those numbers, didn't really do anything to manage stress before, or certainly didn't do anything in an intentional way. And so if you're somebody who's a little lost and I want to try to do some things, I don't know where to start. Maybe there's some of you here who are already taking advantage of some of these offerings. There's lots of different things that we have here, both in person and virtually, that allow you in a space that is safe, that is designed for people who are coping with cancer and recovering from cancer treatment to try, experiment, and do some of these activities. If you've not taken advantage of one of our classes yet, the nice thing is each class is complete in and of itself. Sometimes we offer workshop series, but like we have people that come to our classes like who've never done yoga before. And we've had people who've done yoga off and on for years or have a regular practice, right? We really try to make things accessible. And if you're interested in one of these things, I really recommend that you check out our YouTube channel because most of our classes, we have some recording of almost every instructor up there. And every instructor has kind of their own personality and style. So, you can even do it on your own time in addition to the like synchronous classes, or you want to see like, oh, which class would I like to give a try? You can kind of get a little preview as well. I've talked about the idea of finding what's in your control. I've already kind of given you some ideas of what's in your control, right? That what can I do? What can I move the needle on here? And I'm going to say I'm going to keep moving forward, but if people have any questions or comments about anything I just said, again, feel free to put it in the chat, and I will be sure to address that as I kind of keep moving forward with the slides. Now, one of the challenges I will say with finding what's in your control and trying to make changes in your life is we can always get these conflicting information, right? Like coffee's good for you, coffee's bad for you. Have a glass of wine, don't have a glass of wine. Eat asparagus. You should do the keto diet, right? Like, and I give the examples of like dietary changes because that gets a lot of space in the news. It often can. And there's not really one answer, right? You got to think about like, what is it that is going to give me a sense of control? One thing, like if the treatment has thrown your routine out of whack and you're not yet back into your old routine, it is actually really helpful to set a schedule. And I'm not saying like your whole day is scheduled, but like I'm going to get up at the same time. I'm going to take a shower and get dressed. I'm going to eat breakfast at the same time, right? Some like loose outline to your day or to your week can actually be really valuable if it's felt like time has just sort of bled, or like maybe your day to day has been pushed upon because of treatment schedule and then side effects and having to be kind of reactionary to how you were feeling. Um, Certainly making healthy lifestyle changes is something that can be very empowering, whether that be around nutrition, physical activity, reducing risky behavior like smoking cessation or reducing alcohol intake, um, problem solving, right? Sometimes we have stressors that are not about the cancer, but cause us stress, and we can do something about them. And that leaves us feeling like we have more of a sense of like a sense of power over something. And added benefit, we're not spending our like stress widgets on that thing because maybe we've addressed it. Maybe we've found a way to work around something or to change something, or even to say like I'm dropping the rope on that. Why do I need that stress, right? Like why am I wasting my time going to that PTO meeting when it's driving me nuts? I don't need that anymore. Which kind of goes into the assessing your priorities, right? Like thinking about, making a list, right? What is most important to me? And then I'm going to make that a pie, and I'm going to say, okay, this is like, my family is this important to me. And then, my work is this important to me, and my civil and civic involvement and my hobbies, right? Okay, so now I've got my assessment of my priorities. And then where am I spending my time? And do those things match up? Am I putting my energy into things that are most meaningful to me? That can especially come into play if you have limited energy and you find yourself spending all of your energy first on things you feel like you have to do, and you leave no energy left over for the things that are meaningful for you, right? How can I put myself on the list and put what's important to me on that list? And then I always feel like it's like my due diligence of just like, following up with your doctor, following through on their recommendations, can also be very empowering to know, like, I'm doing what the doctor is telling me to do and what they've said is my best path forward. And I realize I have a typo here. I can't remember if it's 18 sessions or 20 sessions, but if you're interested in making healthy lifestyle, oh man, and I forgot to change the title. I gotta get the wet noodle. We changed the name of this group from weight loss to wellness several years ago, and I still, every time I come into the presentation, I say the same thing. I'm like, it's really called food and fitness now. And I still never changed the name of it. So old habits die hard. So forgive me. And we changed it because it really, the group is not really necessarily about weight loss. I mean, there are people that come to the group for because they want to like maintain or regulate their weight, but it really is a group that is intended to help people make healthy lifestyle changes in a sustainable way. It's co-facilitated by our oncology dietitian, Lori Bambaco, and one of our psychologists, Gabrielle Walk, because we recognize that sometimes you need knowledge to help make changes, but sometimes, there is that psychological piece around behavior change. And especially when it comes to healthy lifestyle changes around food, food has lots of meaning and it's not just about nutrition. And so how do we understand that and respect that if we are wanting to make changes around that? So we always start a group typically around January or February, if that's something that you're like, geez, I would really love to be with a group of like-minded people and be able to get some guidance and some support around that as I'm trying to eat healthier, I'm trying to exercise more, I'm trying to change my relationship with food, I'm trying to change my relationship with my body. This group can be an excellent path forward on that. And the nice thing is once you've gone through it, there's a graduate group so you can continue getting support. And then I think the final thing here is we got to balance two things, right? We got to balance finding things that help us feel hopeful while also not trying to hide or deny the more complicated feelings of fear and anger and sadness, right? How do we find balance within positive thinking? Can we balance triggers along with finding things that help us feel hopeful, right? And one thing that's helpful is to just acknowledge, and I think there's a better understanding now of triggers. When I first started doing this program, people didn't even know what a trigger was, but I think we've talked about it more in our like pop culture, right? A trigger is something that causes you to think about something else. And when we're talking about a trigger around cancer, it causes you to think about something else that is unpleasant, that is stressful, that causes distress. And you'll see up here, there are certain things that you can anticipate. And when it is a trigger you can anticipate, then that creates space to say, what am I going to do to take extra care of myself and recognize this is going to be a higher stress period of time for me. So can I practice self-compassion and can I build in more self-care routines, more downtime, more time with friends, more making sure I take the bubble bath, making sure I do the yoga class. Maybe I'm not as routine about those things, but in those days leading up to having my scan or going in for my follow-up appointment, or it's getting to be the anniversary, not just of the date of diagnosis, but the date of test, the date of treatment planning, the date of surgery, right? There's lots of anniversaries there. Um, then you'll see that there are some triggers here that you can't plan for. They just come up, right? We just got out of October. I don't listen to the radio that much, but like one of the things that can come up is is in October, breast cancer, pink ribbons, right? Like it could be everywhere, right? Or TV shows, man. I mean, how many shows or movies have I watched and I'm like, oh, da 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 da, it's just a family. Oh my God, it's about cancer. And I'm like, now I'm pot committed, and I didn't think it was going to be about cancer, and now it's about cancer. And I wasn't trying to get my mind off of cancer, right? So I think thinking about too of like, like thinking for yourself of like when that comes up, when that even if you don't have breast cancer, right? When you bump into the like pink ribbons, when you're watching the program and all of a sudden the storyline turns into be about cancer, when you find out that somebody you know, or even a celebrity has been diagnosed with cancer or has died of cancer, right? Like those are understandable times that your system gets pushed on, and you may need a little bit of more breathing room to like get back to your like to that homeostasis. Um, I think the other thing too is cultivating hope. And how can we cultivate hope, right? People have different ways, different sources of hope, right? We can think about sources of hope like, you know, knowledge can give people hope, doctor can give people hope, talking with other people that are further out from diagnosis can provide so hope, a spiritual belief system can provide hope. When we think about psychological hope, what we're really talking about is this willpower and way power for reaching goals. And when I say goals, I don't mean like time limited goals. I mean like ongoing things that we want to have as a part of our life, right? The goal of being an involved parent, the goal of infusing humor in your life, the goal of um, being intellectually stimulated, right? These are things that like you work at. I call them toilet paper goals, right? Basically because like I can't go to the store and buy one magical roll of toilet paper and then I never have to buy toilet paper again, right? I have to keep going to Costco. At some point, no matter how much toilet paper I buy, I got to go buy more toilet paper. So that's why I call them toilet paper goals, because we're just always working on them, right? And so if we can get in touch with what's important to us and why it's important to us, right? Why is it important for me to spend time like have family dinners every week, right, with my adult children? Well, that's important because being a constant present in my children's life is really important to me, right? And what can happen is in light of a cancer diagnosis, all of the hope gets focused on the diagnosis. All of the goal, all of the energy gets focused on physical health and well-being, sometimes to the exclusion of nurturing other goals, right? And when we think about hope and we're talking about cancer, what are we talking about? Like hope in the frame of cancer typically means the cancer's gone. I'm hopeful the cancer's gone. I'm hopeful that it's not going to come back. I'm hopeful that I'm going to have stable disease or no evidence of disease, right? It gets whittled down to this one hope. And so if you found for yourself that hope has gotten defined just by the diagnosis, just by your physical well-being, something that can be really helpful is to start looking in addition to or beyond your physical well-being that can still be there, and start thinking about what are the other things that are important to me that I can feel good about working towards having be a part of my life. Because that's really what we're talking about hope is there's something I want in my life that I can actively do something about to have it be a part of my life. And when we do that, when we kind of diversify our hope portfolio, it can actually be protective around the wear and tear and the stress around your physical well-being and the wear and tear around what's going on with the cancer diagnosis. So I mean, the it sounds on face value like, oh, that's horrible, but like more people are living today with cancer than ever before, right? But more people are living today, right? What that's really saying is like people really can have cancer and go on to survive, thrive, continue to have a life post-cancer at higher rates than ever before, right? That keeps growing more and more. So I think in addition to like your own micro level hope, there is hope within the cancer space of really being able to move into this post-treatment space in your life. And maybe if life doesn't look exactly the same, figuring out a way to have a high quality of life and feel satisfied with life in this post-treatment space. So that's the end. Oh, my lights just turned off. Sorry, my lights are on timer here. I'm going to stop share. And I'm going to just open it up for a few moments. I know it's 6 o'clock. I know somebody had to hop off, but want to just stay here for a few minutes to see if anybody had questions that or comments they'd like to share on mic versus via chat. And I think, Lisa, we can stop recording at this point.